So I'm going to show you the story of Emily. Emily is an emergency appendectomy patient. She's in hospital and she's just had surgery and has been admitted to her room to recover. So we're going to connect into the Oneview system now. So Emily puts in her date of birth to confirm that she is the right patient in the right room. And once her date of birth is authenticated, we then have a welcome video personalized to Emily that welcomes her to the room, orientates her to the room and to the Oneview system and what she can do through it. So now Emily is orientated to the room and to the system. So we have the dedicated digital whiteboard, which provides information important to the patient, to the family and the care team to align everyone around the plan of care and the plan for discharge. And then we have the patient's television. This is our MyStay TV. This is providing the patient with access to important information about what's happening, what they need to do, as well as providing them access to content, services, and information relevant to their stay. So as I mentioned, Emily is an emergency appendectomy patient. So she has some education that her care team have assigned to her within the electronic health record that has automatically come through to Oneview. She also has a prompt about an MRI that she has this afternoon to help her and her mum get ready and be prepared for that test. So Emily's going to go in and she's going to watch the education that she's been assigned by the care team and with her mum. So we're going to go in and we're going to have a look. So she's had surgery, so she has a video about infection control. She has the MRI coming up, so she has some content to help her prepare for that, to understand sedation for children, and to also understand how to prepare for having an MRI. Emily is very hungry, so she wasn't able to eat, obviously, before her surgery, so she's very hungry at this point, so she wants to be able to order a meal. So Emily is able to see that she can order a meal here and very easily just go in and go straight into the meal ordering capability. So Oneview is connecting into the dietary system to retrieve a menu that is clinically appropriate for Emily based on the diet order that she's been set by her physician. So if I go into my diet, I can see that Emily is on a soft diet, so she'll only be able to order food that is appropriate for a soft diet order. So I'm going to go back and I'm going to go in and order lunch for Emily. The other thing that we are launching at HIMSS is AI-powered suggested meals. So this is very important for patients who are on restrictive diet orders, who may find it hard to order a selection of meal items, an entree, an appetizer, a beverage that meet those nutritional limits. So now we're able to do this a little bit like recommendations in Netflix or Amazon based on meals that other patients with this diet order have ordered in the past. So Emily can see a butternut squash puree entree, rice pudding, skim milk. She thinks that'd be great. She's very hungry. She's going to go ahead and she's going to order that menu. I'm going to add to the cart, press the order button. We can set the delivery time as well when we want the food to come and press the order. And that now has gone through to the dietary system. Completely automated. The nurse hasn't had to get involved in that workflow at all, straight through to the kitchen. Now, while she waits for her food to come, Emily wants to maybe relax, just watch some content on the Oneview system. But before she does that, she's not feeling super comfortable in the bed. She would love to have another pillow. She's able to do that through the Oneview system using her voice. And this is via Ovie voice, which is our voice capability for patients, families, and the care team. So Emily is able to say, "Hey Ovie, can I get a pillow?"
I can request a pillow for you. Would you like me to submit that request?
Yes.
I've submitted your request for a pillow. Someone will be with you shortly to assist.
So that request has now gone through to the nurse call system, and we can see the request the pillow over here on the nurse call screen. And so that's able to be routed to the appropriate person or team to be able to fulfill that request without having to interrupt the nurse. So Emily's requested her pillow, and now she wants to watch a movie. So again, she can use her voice to control the system and say, "Hey Ovie, can I watch a movie?"
A Opening the movies feature for you now.
So that's opened movies in Oneview. We have a selection of latest Hollywood movies. Emily loves Frozen, so she's going to go in and she's going to start up Frozen, and she can watch that. So Emily's going to finish her movie. Her meal arrived. The tray was a little late, so the food was a little cold, but she was very hungry and she ate it happily. She's then able to go in and provide feedback on her meal. So the system is able to automatically trigger workflows, for example, to collect feedback from patients on aspects of their experience. So we can see that there's now a prompt for Emily to provide feedback on her meal. So we're just going to go in and open up that survey. So it's a very simple survey. So we can see the question is, how was your meal? Great, good, not good. Now, Emily was hungry, so she was happy to have the food, but that tray did come late and the food was a little cold. So she's going to provide feedback to say that it wasn't good. And she's going to submit that. And that feedback then is visible to the care team, so they can actually have that insight into the patient experience in real time. And that will also then trigger around proactively. So the nurse unit manager is able to come into the room and speak to Emily and her mum and understand what went wrong with that experience in order to ensure that they drive continual improvement. Now, Emily's mum knows that the nurse is going to be rounding, but she really wants to have a coffee. It's been a long day. So she wants to be able to leave a note for the care team just to say that she's popped out for 10 minutes to get a coffee. She's able to do that, again, using her voice through the Oneview system. So she's going to say, "Hey Ovie, can I leave a note for the care team?"
What would you like to include in the note for your care team?
The note should say, "I'm just going to get a coffee and I'll be back in 10 minutes. It's just taking a little time to think about that request. We're on the show Wi-Fi here, which isn't super fast, so it's a little slower than a patient would experience this.
Would you like me to post that note for you?
Yes. So we can see that note has now come through to the whiteboard.
See that you're going to get a coffee and we'll be back in 10 minutes.
And the care team are able to see that when they come into the room. For customers that don't have the space or the budget to have a dedicated digital whiteboard in the room, they can use an integrated whiteboard as part of the patient's television. So the nurse is going to come into the room and they're going to open the whiteboard. "Hey Ovie, can you open the whiteboard?"
Opening the digital whiteboard for you now.
And the whiteboard then will display, and the nurse can see the note from Emily's mum to say she's just gone out to get a coffee and she'll be back in 10 minutes. So the nurse is able to come back in when the mum is back to be able to have that conversation with Emily and her mother. So going back to the home screen. So Emily has had her food, she's watched a movie, she's watched some education about her care, she's prepared for her MRI, she's just going to get a little nap now before the afternoon. So she's able to use the Oneview system to control the room. So we're going to go into my room. And from here we're able to set scenes, control lights, blinds, temperature. So one of our scenes here is sleep. So this prepares the room for sleep. It brings the shades down on the windows, turns the lights off, and it also turns the Oneview system off so she's able to get some sleep. So I'm going to do that, and we're going to see Emily's now ready to have her sleep. And so that concludes the demo and helps you understand how the Oneview system improves the experience for Emily, improves the experience for her mother, and also improves the experience for the care team looking after her, reducing interruptions for nursing and making sure that everyone is focused on doing the right things at the right time to ensure the experience of care is as good as possible.